Hello, folks. This is my first presentation in English. I'm a Greek neurosurgeon. My name is Blionas Alexander, and my area of expertise is mainly spine. I also do some uh, brain problems like tumors, angiomas, and such things. But mainly, I like to do spine, and I have many patients with spine problems, and I try to do the best for them. Now, this is our YouTube channel, as you can see, and most of my videos are in Greek, and there is one universal goal for all the videos. I want to educate patients. I want my patients to be educated. When my patients come to the office, I want them to know what's going on, to know the therapeutic options. I want them to be educated, and that's what I'm trying to do here. I don't want patients that don't know what's going on. I mean, it's really important for me when a patient comes and you discuss with him something, he must have an idea of what's going on. He must have an opinion. He must be ready to say, I opt for option two or I opt for option one. And this is my philosophy, and you're going to see my future presentations. And if you know Greek, which you probably don't, but if you know, uh, you will see in the other presentations that the philosophy is this. Main philosophy is to educate patients. So, in this presentation, we're talking about sciatica. Most of you know sciatica, especially the ones watching this video probably know it. And the question is, can we avoid surgery and medication? Usually, when we go to a doctor, he will prescribe meds, he will say about surgery. But here, we opt for something different. We say, can we avoid everything? Is it possible or is it not? First of all, what is sciatica? Most of you know, especially people watching this video, specific type of radiating pain. The pain starts from the back and radiates downwards towards the leg. Now, it could be a part of this or little parts like here, here, and here, but usually it's a running pain. It starts from the back and goes down. This happens when the sciatic nerve has a problem. This is the sciatic nerve. And usually the problem of the sciatic nerve is a pressure in its roots. These are the nerve roots exiting from the spine. This is the spine. These are the vertebrae. These are the discs here, and this is the spinal canal. Inside the spinal canal, the nerves travel. Sometimes there's pressure inside the spinal canal due to stenosis or herniation, and this causes sciatica. So the sciatic nerve has a problem, and usually the patient comes and asks us to solve the problem. So why could the nerve be pressured? I mean, what can cause pressure to the nerve? First of all, disc herniations. We see the vertebra here and the discs, these yellow things here. So when the disc goes away from its normal position, it herniates, you can see it can start applying pressure on the nerve. And if this nerve is pressured, then what happens is sciatica, because this nerve fuses with the other nerves to create the sciatic nerve. So when there's reduced space, which is the case of stenosis, there's not enough space here, so this is pressured. And when you have a herniation, these are the main causes of sciatica. There are millions of other causes. We are talking about the most common causes that you probably will have, most of you, many of you. Now, when we talk with a doctor, we are doctors. Let's be honest with each other. We have strategies. We usually want to do surgery because we're surgeons, and many of us want to give meds. We want to do something. If I see you, you come at my office and I say, go away, you're going to say, what kind of doctor is he? But the truth is that there are other strategies instead of doing the standard things, surgery, meds, and physical therapy. Physical therapy helps, but there are so many cases when we have patients doing physical therapy when they don't need physical therapy. It's so common. So these are the usual strategies. Are there other options? Yes, this is what we're telling here. This is the message I want to send to you, to the patients. Yes, conservative strategy is a thing. And when we say conservative strategy, we don't mean meds. Because when we say conservative, we mean don't do something. If you do physical therapy like 3 times per week and 3 or 4 meds, this is not conservative treatment. And many doctors are going to say that this is conservative. I mean, I'm giving you meds, I'm doing injections, and this is conservative. No, that's not like that. Conservative is a different thing. Waiting is conservative. We can say to the patient that, you can wait 6 months and see what happens. And 70% of the patients will become better. This is written in many studies. If you search PubMed, you're going to find like 10 or 20 studies which prove this. So waiting has 70% effectiveness, and strengthening abdominal muscles and back muscles has like 80% effectiveness, over 70%, definitely over 70%. So these two strategies, which is not exactly strategies, when you don't do anything, you say to the patient that you have to, do exercise and you have to wait. These have over 70% effectiveness. So we can start with much simpler steps. And that's what I want to send you here. That's what everybody I want to know. So what should I do? Because the big question is, okay, I have sciatica. I feel pain that's radiating from the back. It goes with the leg. Should I do what you say? Should I do conservative treatment? Do nothing? If we have muscle weakness, no. I should be aggressive. I should do something if I have muscle weakness. If my leg has less strength than the other leg, if my foot is weak, then I should do something. But if there's no weakness and there's only pain, then you can try conservative. Definitely, you can try conservative. So this is what everybody should know. If there's no weakness, you can start, and you should start with conservative. It's reading textbooks. We were taught this, but when we become doctors, neurosurgeons, we forget about this. We say, okay, I'm a neurosurgeon, I gotta operate, I gotta give meds. No, it's not like that. It's not like that. You can go conservative if you only have pain, and if this pain is manageable, of course, because if you have so much pain that you can't do anything, then definitely waiting is not the case. Okay, so if you have manageable pain, you can try, and you should try conservative. So let's see our conclusions now. It's never imperative, nothing is imperative in medicine, but about this presentation I'm talking about, it's not imperative to use surgery and meds in every case of sciatica. Forget about it. When weakness is the case, things change a lot. Then we have to be aggressive. We got to do things. Usually we got to do surgery. If this is not possible for many reasons, we at least have to do meds. We got to do something, because if we leave weakness unattended, there's a very large possibility we're going to lose muscle strength forever, which means that we will have a weak leg for the rest of our lives. And this is a really big problem. Now, in other instances, if it does pain, which is of course manageable, and we don't have any serious problems that don't allow us to live, then it's okay to go conservative. We have good effectiveness with conservative treatment, just waiting or just strengthening up our muscles. And even if we do nothing at all, we just say to the patient, wait, we're going to have like 70% of the patients, which will be greatly improved. So these are my conclusions. Thank you for watching my first video in English. I hope you liked it. And if you want a distance consultation, I'm always available. Definitely, I understand that most of you are not living in Greece. But if you are living in Greece, you are in Greece right now, we can, of course, arrange a meeting so I can see your exams and offer you solutions. But we can always do a distance consultation, always. And I'm really, really very, very happy to see your exams and help you. Thank you very much.